Hi, my name is Sarah Lucas. I am global lead for DataDelta at IDinsight. DataDelta makes it faster, easier, and more cost-effective to collect high-quality data from people. And we have driven an innovation agenda over the past several years that's really focused on striking a good balance between quality, cost, and time. Because data directly from human beings is such a valuable resource for informing policy and programs that affect these people's lives, but it can be really expensive to collect data directly from humans. So we really set out to say, how can we ensure that we get high quality, cost-effective data about people so that the programs and policies that affect their lives reflect their experiences? So today we're going to talk about two of the innovations that our DataDelta team has driven to strike this balance between cost and quality. One of the innovations is around sampling, and one is around data quality assurance. So we're going to talk through each in turn, and we have an amazing group of people with us today to have this conversation. I'll introduce the teammates, and then we'll dive in. Red Mulu is on the DataDelta R&D team. She's done a lot of work on both the data quality assurance and the sampling. So she's going to talk us through both of those innovations today. She's based in our Delhi office. Nyawera Gitahi leads our DataDelta team in Africa. She's based in Nairobi. Michael Sabele is a manager on our DataDelta team in Africa, based in Lusaka. Elvis Otwoma is an associate on our DataDelta Africa team based in Nairobi. And Nyawera, Michael, and Elvis have just put these two innovations to practice in a recent survey project that we did in Kilifi County in Kenya. So they'll be talking through that experience. So let us start with sampling. When you do a survey, you normally are trying to learn something about the general population. But it's not feasible, unless you're doing a full census, to go to every single household within a particular space. So somehow you have to choose, how do we know which households to go to so that we get a representative sample? That's called sampling. And actually, this is one of the hardest parts of doing a household survey. The most traditional and rigorous technique for sampling is to list every household within a particular geographic area and then randomly sample from these lists. But that is really slow, it is tedious, and it is quite expensive because each enumerator has to go and develop the household listing and then return to each of the houses that they're sampling. There are cheaper methods out there, like field-based randomization, including the right-hand rule. That allows the enumerators themselves to randomize as they're moving through communities. This is fast and cheap because it bypasses the household listing, but there's real significant quality concerns about that. So our DataDelta team set out to find a cost-effective approach to sampling that also has good quality standards. So today we're going to talk about one of those sampling innovations, which we call rooftop sampling. So I'm going to turn it over to Red to talk us through the technical side of rooftop sampling. What is it? Why did we do it? Over to you, Red.
Thanks, Sarah. So yeah, just starting with a bit of an intro to rooftop sampling. In the first stage of the sampling process, rooftop sampling also kind of resembles a listing, a sampling method that relies on listing. So in the first stage, teams would select the primary sampling unit that they're interested in working in. And this rooftop sampling is compatible with any size. So you can select, district, sub-district, county, or even subunits that are smaller. And in the next stage, instead of listing households within that given area, you instead use rooftops as that set of households. And this rooftop data set is found online and is available and is compiled by Google and Microsoft. And you proceed with the sampling process by basically dropping GPS locations either on rooftops or very near a rooftop on a road. And this after this set of GPS points is compiled by the project team, you give it to enumerators, and along with a very detailed protocol that allows them to kind of first navigate to the pin drop GPS location, and then helps them to identify a structure or building associated with that pin drop, and then sample households within that building. An important consideration in this process is that this process has to be replicable. And what I mean by that is that if we send two surveyors to the same location, they should essentially come back with the same building and the same household being sampled. Otherwise, a surveyor discretion is introduced, which biases the sample. And for this to happen, a couple of things have to come together. What I'd like to highlight, first of all, is that pin drop method is something, or rooftop method is something that relies a lot on geospatial information. And for that, you kind of have to use very good tools that allow you to have good accuracy with your data. We've explored 4 different tools in our R&D process, and the first and obvious candidate is Google Maps. We've also seen Google My Maps, and another one that is also compatible with Survey CTO called MB Tiles, and the good old-fashioned paper maps. And we kind of ranked them based on different, matrices like accuracy or readability, pointer accuracy, which is super important because it allows surveyors to kind of track their live location on the spot, clarity and ease of use, and the intensity that is required for setting up the system, if the map has offline functionality, and if it's scalable. And based on this, we find that Google My Maps kind of gives you the best set of advantages across these criterias that I mentioned. And once a surveyor, uses this tool and arrives in the vicinity of the pin, there are 3 major processes that they have to undergo. The first is finding the exact location of the pin, and then finding the structure nearest to that location and sampling households within it. Finding the exact location of the pin is actually most of the work here, and this is where you have to give a lot of detailed instructions on how to do this. The protocol that we have tested and has given us 100% or very close to 100% replicability instructs surveyors on how to navigate, first of all, how to select a starting point very close to the pin, and how to design their path by counting roads or gullies, as we call them in India, and how to kind of compare their what they see in real life with what they see on their maps, and a bunch of other techniques to basically find the exact location of the pin. After this, the process is mostly carried out through a Survey CTO randomization process where you select the nearest structure and how many floors there are within the structure, and the Survey CTO kind of outputs for you a random floor and a random household to select within that. As Sarah mentioned, this is a method that eliminates the process of listing, which is estimated to be about 20% of a household field costs, household survey field costs. So it's quite cost effective, and like I mentioned, the maps are freely available and accessible online, so it's a viable option to consider.
Thanks so much, Red. Let's turn it over now to the Africa Data Delta team to hear about how rooftop sampling worked in practice. Nyawira, I'd love to start with you. Can you tell us more about the sample survey that we recently conducted in Kilifi County in Kenya? And tell us about who was it for, what kinds of decisions were they trying to make with these data, and why did the sampling approach matter?
Thanks, Sarah. So the partner in this case was Kilifi County here in Kenya. We had signed an MOU with them earlier on, that's a memorandum of understanding, in January 2025. And they had expressed several data needs, with their highest priority being putting together a new Kilifi adolescent health strategy. For this, they required to revise the existing strategy, which was the tenure was ending that year because it had been developed in the year 2000. And the challenges they expressed were not having enough data to put together this new adolescent strategy. For example, there were emergent areas that were not really a priority the last time round, such as mental health issues. They were not clear about how their health interventions that were being carried out within the school system were intersecting with the education space, and they did not have clarity around certain areas such as the social demographic drivers of adolescent health in terms of how they utilized health services, how the uptake of health services looked like, and what their motivations were. So we therefore ended up having to think about how to sample and how to collect data from around 2,100 households to capture 2,700 adolescents within the community. We would also have to sample schools. We'd also have to sample health facilities. And this is where the entire, thought about sampling and household listings and schools listings and health facilities would intersect in us thinking through how we would innovate and use rooftop sampling. The main reason why we needed to do this is obviously to ensure that we had an easier way to capture information. There are very few logs of how many schools there are in the sub-counties. There's little information around where to capture health facilities, even if they're on a health systems list somewhere. And of course, when it comes to the households, we rarely know where adolescents would be. But taken to the fact that the population in Kenya and in Kilifi County, 2/3 of it is actually adolescents who are aged between the ages of 10 to 19. We were pretty confident that a rooftop sampling would be a potential route towards being able to sample and capture the sample size that we required for these adolescents, Sarah.
Thank you so much. Michael, I know that you were on the ground with the enumeration team when this survey was playing out. So can you give us a sense of what was it like in practice for the team to use this new method for sampling?
Thanks, Sarah. I'll start by saying the pin drop sampling is not really intended for surveys where you're targeting a subgroup of households. But according to the demographic and health survey, about half of all the households in Kenya have at least one adolescent. Therefore, we opted to use the pin drop sampling with this background in mind. The data collection in Kilifi was conducted in 7 counties. Our goal was to obtain a representative sample of 390 adolescents. That's between the ages of 10 to 24 per sub-county, making it a total of 2,700 adolescents. And we dropped pins on rooftops, and each pin was associated with 3 households, therefore giving us more options. With regards to advantages, it bared a lot of advantages. The pin drop sampling had quite a number of advantages. The first one being you cut down on listing costs. So this proved to be very effective in Kilifi. The method significantly reduced staff time and resource requirements by eliminating the need for household listing exercise, which comes with various field and non-field costs usually. So the use of rooftop sampling also allowed us to maintain sampling rigor while minimizing overall costs. Ideally, using the traditional sampling method, we would have to conduct a household listing before the actual data collection and then engage the community and do all sorts of like community mobilization. Then furthermore, the random rooftop sampling method was effective in helping us reach our target age group with minimal need for resampling. Additionally, we surpassed our adolescent respondents target by 35%, further reflecting the effectiveness of the sampling strategy. Thanks, Sarah.
Okay, thanks so much, Michael. And Elvis, I know you were also present during the data collection. I'd love to hear from you. You know, we were really testing this method out in Kilifi, and we've used rooftop sampling in 8 other counties in Kenya. But was there anything specific about Kilifi that we really needed to know in order to apply this? Tell us more, like what worked? Were there any challenges or snags? Just pull back the curtain for us a little bit on this experience in terms of what we learned from it.
Yeah, so Kilifi was basically like the 9th county that we used this in Kenya. Last year we did it in 8 different counties. Kilifi is different in that we already had a specialized team there. We've worked with them before. They sort of like understand the work we do. So when we came with a new sampling method that we're also testing out, they sort of like understood the utility of like, we're trying something new. It's not what you're typically used to, but they were very willing to sort of like give us feedback and sort of like work with us through the different challenges that they experienced. I think initially the main challenge was just that we are targeting households. Rooftops are selected, like Michael said, that like there's, I think, 1.3 adolescents per household in Kenya, and specifically in Kilifi County. But the thing is, we started out the surveys when schools were still in session, so the possibility of finding adults within the target age group at home was only possible for like a specific window during the day, mostly at around 12:30 to 2:30 p.m. when they were back from school for lunch, and then we could get them. And then these other times we used to find like some of the households have some of the kids, some of them don't, because schools were closing around the same time as well. But the other thing that also went really well was just that like we already work with the CHPs there, so it was really easy for them to sort of like introduce our enumerators to these different households, because people are just showing up with like a pin on their phone and saying, we want to survey you, why us specifically? So also just having the team of CHPs on the ground was really useful. And I think the only recommendation that I would say we have for other teams that want to implement this is that they should really time the like finding the households with the target age group that they want specifically. It's really useful when you don't have a specific kind of requirement of a household. So like for the shift surveys that you did, any household would do, but in this particular case, we needed a household with a specific characteristic. So just think about the specific things that would allow you to find your target audience or target sample early enough. Yeah.
Thank you so much. And what I'm taking from all of you as you're talking about the application of rooftop sampling in this particular case is that despite the fact that we were targeting specific households with adolescents, we were able to use rooftop sampling because adolescents are prevalent in households across Kenya and Kilifi County. If we were trying to target a subpopulation that is much less prevalent, say, for example, children with physical disabilities, then we probably wouldn't have been able to use rooftop sampling because we would have needed to do the listing first to understand which households had those children. Is that correct? Yes, you're all nodding. Excellent.
Yes.
Okay, so thank you so much. Another lesson I'm hearing from you is it was really important and helpful to have enumerators or community health promoters that know these areas well. That made it even easier for them to interpret the pins, understand the geography, know which households to go to. So that was a really added bonus that we had in Kilifi, though probably is not necessary for any team using the rooftop sampling. Michael, before we transition to our data quality discussion, I want to hear a little bit more from you. I know that you had an opportunity to go back to some of the households after the survey, meet some of the adolescents, and hear about their experience with the survey, or their issues that they're thinking about in terms of prioritizing adolescent health. So can you just paint a picture for us? Maybe tell us about one or two people that you met. Help us envision who are the kinds of folks who might benefit from the fact that we've collected this data.
Thanks, Sarah. Yes, we did collect stories from a couple of respondents, and I'll highlight one of the respondents who's a female respondent in Kilifi, and who we sat down with to get some of her stories on how adolescent health is impacting her in Kilifi. So she tells a story of a young friend who struggled with pregnancy complications and faced barriers such as fear, lack of confidence, and financial constraints in accessing healthcare services. As well as she highlighted a lack of youth-friendly health services, emphasizing the need for mental health and sexual education that is currently not easily accessible for adolescents. She also recounted positive experiences with a school counselor who provided mental health education, fostering a supportive environment and promoting health-seeking behavior at the school. Finally, she provided a couple of recommendations. First of all, calling for confidentiality and non-judgmental health services specifically tailored for adolescents to encourage them to seek care without fear of stigma, as well as she suggested creating some confidential welcoming spaces staffed by trained, kind professionals for youth to discuss their health concerns freely. And how does this relate to rooftop sampling? I would say the use of rooftop sampling for this reaching respondents like this one in particular is pertinent because it can identify individuals in diverse settings who may otherwise be underrepresented or overlooked in traditional sampling methods. And the technique as well enables us to uncover a range of experiences and perspectives, particularly among youth-facing health service barriers, which is crucial for developing and implementing more inclusive health interventions for the government.
Thank you. And that ties back so nicely to what Nyawira shared with us in the beginning, which is real gaps in the adolescent health strategy, particularly as you're saying around mental health. And it sounds like there's some real actionable information coming out of this in terms of the kinds of services adolescents need, the kind of spaces they need for confidentiality and confidence to share their health concerns. So yeah, thank you so much for sharing that. All right, we're going to pivot now and talk about the DataDelta innovations around data quality. And let me just say that at the most basic level, data quality means that the data that we produce accurately reflects what respondents tell us. And as you've just heard from Michael, through some of the surveys that we conduct, including the one in Kilifi, individuals tend to share deeply personal insights about their families, their well-being, their experiences with public services. And the goal is for that information, those experiences, to directly inform the policies and programs that affect their lives. That's what Nyawira experienced or explained in the beginning, which is like these data are directly going to shape an adolescent health strategy in Kilifi. So if your data is low quality and it doesn't accurately reflect people's conditions and experiences, that can lead to misguided policies, poorly developed programs, misallocation of resources. That's what we're trying to avoid when we think about data quality. And in technical terms, that means that we need to control for the most common risks to data quality that can happen during live data collection: outliers, falsified responses, violations from the survey protocol, logic violations, frequent non-responses. If there's an indicator or a question that people aren't responding to over and over, that could signal that they don't understand it or it's too sensitive to probe on. So these are the kinds of things we're checking on data quality. Anyone who's doing a survey of households will have some form of data quality checks in place. That's usually a blend of desk-based checks, so high-frequency automated checks on your data that's coming in, and field-based in-person checks like spot checks or back checks. But each of these data quality measures comes with a cost. So it's important to ask, like, how much data quality assurance is enough? You can overdo it and blow your budget, and you can underdo it and risk the quality of your data. So we set out to evaluate the cost effectiveness of the data quality assurance that we were using in our large scale surveys, and to see if we could strike a better balance between cost and quality. So as a result, we've developed a recommended default approach to data quality that blends these desk-based and field-based checks, and that we're now using in projects across Africa and Asia, and that we tested in this Kilifi project. So let me turn to Red to give us an overview of what that data quality optimization approach is, and then I'll come back to the Africa team to tell us about how it played out in Kilifi. So over to you, Red.
Yeah. Starting off with like the methodology we used to arrive at the recommendations we ended up making. So we used both qualitative and quantitative analysis. On the qualitative side, we interviewed different teammates within projects that had data collection as a major part of the project cycle. And we understood their experiences, the way they interacted with data quality systems, etc. On the quantitative side, we did a data volume reduction simulation, which is basically kind of analyzing whether retrospectively, when we reduce the amount of data that we collected per data quality check, do we lose information from that? And we also, in addition to that, did a cost measurement analysis where we measured through teammates' time on setting up DQ systems, how much data quality systems cost. So right off the bat, we kind of started noticing certain status quos about our data quality systems. First is that there are these conventional practices that we have stuck with through time. And what I mean by that is even though different types of projects varied, we noticed that we were still consistently applying the same amount of, or collecting the same amount of data quality information in those projects. Like HFCs, we collect data on 100% of our questions. Spot checks is around an average of 11% of the data that comes in. In-person back checks around 12%. And a potential inefficiency with this is that intuitively, when project size varies and team size varies, we also would expect data quality measurement or amount to kind of vary. The other thing that we noticed is that our DQ checks operate in silos. And what I mean by this is that the information that we're getting from one check is not used in designing and basically measuring the next type of DQ check. And a potential inefficiency with this is that we could result in doing double work, like we could be getting the same information from two types of checks that we're doing. The other observation is also that teammates, when given a chance, kind of had a maximalist approach where they felt like, doing as much as possible is the best way to go forward. And this is something that we found overburdens teammates and overutilizes budget. On cost side, we noticed that HFCs constitute to about 20% of the DQ spending on projects generally, and about 80% approximately goes to field-based check. This immediately raises a flag that we should, utilize HFCs to inform our decisions better. The other thing that we noticed is that out of the field-based checks, spot checks are the most expensive, followed by back checks, and audio audits are the most cost-effective ones. And we also noticed that, a Stata-based data quality monitoring system is twice as costly as a dashboard-based one. In addition to this, when we did the simulation of the data reduction by half, we noticed that about 90% of the information that we are getting still remain the same at the enumerator level. So based on these interesting findings, we came up with a couple of recommendations. The first is to have a targeting approach in our data quality systems, wherein in the first week of survey or in the first couple of days within the survey period, we start with HFCs and analyze which enumerators are bottom performing through this check, and subsequently check them through different other field-based checks. This breaks the silo, mode in which DQ checks are operating currently. The next is that we generally recommended a reduction in the percentage of data that's collected by each DQ check, which is estimated to result in, a lot of cost saving. This is hypothetical, but let's say if we were to reduce back checks by half, we would approximately expect cost savings up to $5,000, audio audits up to $6,000. So there is a sense in which, reduction is a way forward. And we have kind of measured the right percentage, or a rule of thumb percentage of data to collect by each DQ check. And of course, when given a chance between Stata-based versus dashboard-based, we would recommend a dashboard-based data monitoring approach. And finally, out of the field-based checks, we would recommend, listening in or using audio audits more than other field-based checks, just because of the fact that they give us more advantage and are less costly as compared to others. Yeah. Over to you, Sarah.
So helpful to hear that. It sounds like what we're recommending is kind of a smarter approach, like using our automated checks to inform and target our field-based checks, which are more expensive, and just to diminish the amount of data flowing through all of these checks, because we were just duplicating effort and getting no additional information. So really, really awesome that you guys did this analysis, and it's now directly affecting how our teams are working in the field. So Nyawira, tell us how this has worked in Kilifi, and actually, if you could set the stage for us again about how these data are going to be used and why data quality really matters in terms of how these data are going to be used.
Thanks, Red, for setting the stage for us as we get into this piece. So Sarah, let me rephrase your question further and ask the question, why does good quality data what does good quality data do to impact not just the evidence generation that we just did, but the policies downstream that our government partners in Kilifi were hoping to have. So one of the overarching consistent requests that DD receives when we engage with governments at national level and even at subnational level, just as in Kilifi, is a need for data to use for timely policy making. And so it is empirical and it is critical that the data has gone through all these checks and that it was done in a cost-effective manner, and that we did not break the bank to do it, because then it's not something we can consistently be able to provide as a value add to our partners each and every single time. So with regards to this specific fantastic project that we are very excited to speak about, data quality aspects that we included and that we incorporated made sure that the county was able to make, and it will be able to make, evidence-based policies. The fact that we were able to both sample the correct population, do it well, make sure that the data was representative, which is one of the factors of good quality data, ensured that then would accurately identify the needs of this very important subset of the population. So the data revealed real health challenges, as has been, really elucidated by Michael. The mental health issues, we looked at substance abuse issues, we looked at nutritional deficits, we looked at reproductive health needs, and gained a lot of insights from this. This information, will be used by the county to redefine what the current theory of change looks like with regards to their adolescent strategy. They would be able to make tailored interventions and ensure that the policies are then targeting adolescents correctly, based on even the age disaggregated data, ensuring that we have enough of the older adolescents, the young adolescents, and all the way to what we call older adults, young adults in the transition stage. And this is part of the pieces of good quality data that we did, and we made sure that the quality checks were well represented within each appropriate age gap. The data, good quality data, also helps them to stop making assumptions, basing policies on data that has deficits or on older data that is not timely. The issues of mental health clearly came out, and this is something that no other county has actually put in within their current TOC. So we're looking forward to seeing what this looks like in terms of implementation. Again, the data that we presented, because of the quality of data that had the elements of representation, as well as the fact that it was good quality data, it provided a baseline. We're very clear that the data that we collected will also help the Kilifi County to be clear about how they will justify resource allocation around the adolescent space. What will be cost efficient for them in terms of the intersections around school health? What will they where will they intervene? Is it at the school level, at the health facility level, and what will they prioritize? And then last but not least, I think the fact that we were able to have the Kilifi County officials, as well as other stakeholders who work with them, all involved in the process. There was a lot of transparency. There was a lot of community involvement, and there'll be an opportunity to even have comparisons in future, because what we did is we ensured that the indicators that we collected are aligned with the National Adolescent Program and are aligned with the WHO standards, and they will be able to compare where they are in future and continue working as a team, because good data collection and good data quality practices mean that you also have a co-creation process of the entire data collection and data quality process, so that you're very transparent to all stakeholders. So that's about it, Sarah. And I think the one that I always lean on to the most is equity. DataDelta is all about ensuring that we are giving the vulnerable a voice and ensuring that we reached in all sub-counties, ensures that we address the disparities that each of them face, all their voices were heard, and the only way was ensuring that we have good quality data to ensure that this was done in a precise manner, was efficient, there was equitable use of resources in future, and it was impactful. Thanks.
Thank you so much, Nyawera, for the very compelling kind of overview of the why here on the data quality, and this point around ultimately, surveys are capturing the voices of vulnerable people and bringing those voices directly into policymaking and program planning. And if you distort those voices with poor data quality, they don't reach. But the point of pursuing data quality is so that those voices really reach decision makers to inform policies and programs. So thank you so much for laying that out. Elvis, now tell us the practical nuts and bolts of this. Like, what did it mean for the team to be executing this data quality optimization approach in Kalifi?
So essentially, it just means connecting all these different data quality checks that we used to do separately. Like Red mentioned, they were all siloed. So connecting all of them so that they flow from the desk-based checks informing the field-based checks that happen. And in practice, specifically for Kilifi, it meant that we had set up on Survey Stream a ranking for all the enumerators that we had. And the logic based on the recommendations from the R&D team was that we rank them from the best performing ones to the lowest performing ones. We take the bottom 50% of those, and then we sample their submissions for, first of all, audio audits. The audio audits are randomly then assigned to supervisors. The only thing we have to make sure is that we're not assigning a supervisor to do an audio audit for a member of their team. Once they've conducted the audio audits, the outputs of that audio audit will basically inform which enumerators do we need to do spot checks for, which enumerators do we need to do observational field checks for, and in cases where maybe there's like really gross violations, do we need a back check, do we need a survey redone, or things like that. So the logical flow of the decisions was based on the information that we gather from the previous checks that we were doing. Whereas in contrast, previously we would do all these things at the same time. We decide which checks to do based on the severity, if any, of the violations that they have done, in case they have any violations based on the spot checks, based on the audio audits that we conduct. During survey implementation, what ends up happening is that an enumerator will be spot checked observationally by the supervisor, but there's also a spot check survey form that the supervisor can use to conduct surveys or back check surveys for any households where they feel that probably the enumerator did not follow protocol correctly, or they did not follow the recommendations that we had in practice. The other side of it is that supervisors also have the opportunity to use the dashboards themselves to determine the productivity of their teams and also the kind of data quality that they're getting. So what we had to do really early on in the process is ensure that supervisors are also set up on Survey Stream and they get enough training on the dashboards, what they're looking at, what it means, how to filter through different types of data and things like that. And the unexpected thing that ended up happening was that instead of them just waiting for us to like provide recommendations and like 2 to 3 day cadence of data quality, the supervisors, sometimes when you accompany them in the field, you could see they're literally just like scrolling through the dashboard during the day to check on how their teams are doing, to look at the productivity that they're getting, to see what kind of flags their teams are getting. And we, in some cases, sat through the daily debriefs at the end of the day when the supervisors are debriefing their teams, and they would give their teams this feedback before we even have them do the audio audits and these other checks. So that was how it ended up playing out in the field.
You know, I think a lot of people, when they hear data quality, imagine like after you collect all your data, you go back and you check its quality. And what you have so well described, Elvis, is this highly like real-time iterative process of using these DQ checks to immediately be supporting enumerators to improve their performance, to immediately be improving data quality in a real-time, day-by-day basis during a survey. This is a highly iterative, highly interactive, data-informed process that's going on in the field that's enabled by this approach that allows you to use the high-frequency automated checks to target your field-based checks in real time. So you've articulated that so well, and it's cool to imagine it playing out in the field. So thanks for sharing that. Michael, did anything go wrong? Were there any challenges? Like what worked and what didn't work while we were using this DQ optimization approach in Kalifi?
Thanks, Sarah. I'll start by saying the DQ optimization approach is unique. It's quite unique and different from other approaches, DQ approaches, in that it seeks to, I think, first of all, as Elvis and Red indicated, it seeks to use high frequency checks, which are the desk-based checks, to target field-based checks. as compared to other approaches that use field-based checks at the discretion of their team mostly. And as well, the DQ optimization approach reduces the number of DQ checks without really losing insights into the data quality. And finally, to sort of like manage the data quality workflow on service stream. With regards to the Kilifi project, we implemented a couple of those. I think first of all, starting with a 2 to 3 day reporting cycle, which is a feedback loop between when we conduct HFCs and field-based checks. Then also we used a superset to monitor enumerated data, quality and productivity. And as well, we used, we conducted 10% audio audits on surveys submitted. And finally, we did spot checks conducted by supervisors on all the enumerators at least once during the entire data collection. The DQ optimization approach had a couple of advantages. I think first of all, starting with time saving, we saved a substantial amount of time spent on conducting audio audits by the team in comparison to other surveys that usually might end up conducting like 100% of audio audits. Ours was sort of just like on 10% of these on the submitted surveys. But as well, that translates to cost saved when it comes to like engaging some of the field teams and ensuring that we don't overspend in terms of like field costs with regards to audio audits and spot checks. Then the other advantage is also on giving supervisors the independence that's required to conduct various checks on their teams based on the approach. And with regards to what didn't work well, I would say I would recommend essentially just maintaining the 1 week reporting cycle, which is the data quality reporting cycle, as opposed to the 2 to 3 cycle that we used and which seemed a little bit shorter. Then as well, ensuring that teams test out the tool and the approach multiple times before beginning data collection. With those few remarks, I think back to you, Sarah.
Yeah, you're making an important point here, which is to really smartly use HFCs to then target field-based checks. You actually need a few days, right? Like hopefully more than a week of data collection to really take full advantage of these feedback loops. So yeah, thanks for sharing that. So Elvis, I know you had a chance to talk with some of the county officials about their experience with the survey and how they're going to use the data. Did you get any insight from them about how they think about data quality or why it matters to them?
I think the one that stands out the most is the county M&E lead. A lot of the data that they used to use previously was based off of submissions from doctors on the DHIS or KHIS systems, but it's not really accurate or complete most of the time. It's most often delayed, so they can't rely on it to make decisions. So when we walked them through the kinds of changes and data quality checks that we are doing on our data and the data that will end up with them, he was really excited about like having data that he can trust, first of all, and also data that is like accurate and recent, and you can make decisions based off of it because you know just the amount of effort that has been put into the data quality. So that's, I think, the most standout thing that I saw. Cool.
Thank you so much. Well, let's close it out. I'm going to do a quick round robin with each of you, and I'm just hoping to hear 1 or 2 sentences. You know, we've talked about how our innovations are driven to optimize cost and quality, whether it's sampling or DQ. Just close us out with why this matters in the big picture, where you have been so articulate about the whole purpose of these household surveys is to really give voice to the experiences of people, sometimes very vulnerable families, so that their voices can influence policy. But yeah, I'd just love to hear a closeout from each of you about why this work motivates you, why it matters. Red, let me start with you.
Yeah, I was particularly motivated by the aspect that finding these innovative methods that also have cost efficiency at the core essentially means that we're producing something that potentially many people use and cost will not be a barrier to use. And yeah, sometimes, people who are committed to impact don't necessarily have the tools or the resources to effectively carry out that desire or vision. So just making it accessible is a huge, motivation for me.
Well, thank you. You've driven so much of this work. So thank you so much for sharing your motivation. Michael?
Yeah, thanks, Sarah. Yeah, essentially, I think striking a balance between cost and quality is essential, I think, for most of the project, as well as ensuring that we have the much needed impact that's stemming out from the work we're doing, and ensuring that we utilize our resources effectively by not overextending those, which is critical for sustainability and integrity of the work we're doing. In the context of sampling and DQ as well, finding this equilibrium helps to maintain high standards of our work and the rigor, while also being mindful of the budget constraints. Yeah.
Thank you. Elvis?
Thanks, Sarah.
I think for me, it's the clients that we work with have to make really important decisions about the lives of so many people, and they really need accurate data to do this. So having the chance to try out all these different systems that are very important to decisions that need to be made and have to be made continuously is a big part of the motivation for me to use these different tools, try out different methods to get them the best possible quality data in very resource constrained scenarios. So I think for me, it's just these decisions are very important and they have to be made the right way. Yeah.
Thank you. Nyawira?
Thanks, everyone. And just fabulous last remarks is what I'm going to say. I'm just going to echo what the team has said. In this day and age where there's lots of data, and we are moving even to, easier ways of managing the data, analyzing the data, getting insights through AI and other methods. I think one thing that has become very clear is that it is rubbish in, rubbish out. So the initial data, there will always be room for some form of primary data collection or some form of initial, data set. And that data set, the quality of it is so important because, as my colleague Elvis said, people are making huge decisions about millions of people's lives. So being at the intersection of being in a place where you can affect the impact of some of these decisions in policy in a way that does not break the bank is really the crux of the matter. Finding a cost-effective way of ensuring that we have good data that is representative, that is at the heart of equity, that is at the heart of giving those who are vulnerable a voice, and ensuring that the decisions that are being made are just representative of all people and not harmful for that matter. So that's my driving force around really supporting this work, being an advocate for piloting it and ensuring that we have recommendations that we can share. Thanks, Sarah.
Well, thank you, Nyawira. That's a great place for us to close. So thank you, Red, Elvis, Michael, and Nyawira for walking us through all of this. It is an honor to be part of this work with you. And thank you so much for everything you do.
Thanks, Sarah.
Thank you.